Good morning. I'm LaShondra Shaw, PIO for the City of Austin and the moderator for today's press conference. Spanish interpretation is available on ATXN 3. To start, we will have opening remarks by Dr. Desmar Walks, Austin Travis County Health Authority, followed by Adrian Stirrup, Interim Director, Austin Public Health. Then Janet Pichette, Austin Public Health Chief Epidemiologist, and Cassandra De Leon, Austin Public Health Administrative Officer for Disease Prevention and Health Promotion Division. We will then open it up to our pool reporter who will ask questions on behalf of the media. Dr. Walks, over to you.
Good morning. We're here this morning to make our plea for our community to stay safe this week when you're gathering with those outside of your household. Our community transmission rate, which is one of our key indicators for staging, is on the rise. And as we head into this holiday weekend, we ask that we take the measures that we know work to help decrease the spread of COVID-19 in our community, but in particular in our family gatherings. Community transmission rate is critical in tracking surges, and we must continue to emphasize that the data that we're using to make the decisions that we make when we're moving between surges includes this, as well as our hospitalization rates. The community transmission, the way this virus is spreading in our community, is something that tends to happen before hospitalization. So a person gets sick, and then after 7 to 10 days, they require hospitalization. So we're using this to help guide our guidance for the community. Areas in our state and in our country are trending up in cases. Areas where vaccine rates are good, they're high, but there's a lagging or lax use of masking and social distancing. And in areas where these increasing cases are happening, we're also noticing that there are folks that are getting sick who need to have boosters. So it's a combination of factors that are impacting these surges that we're seeing in places like Colorado and close to home in El Paso and Amarillo. So we want to keep the most high-risk people in mind when we're gathering this week, and open windows and stay outdoors as much as possible. Wear a mask around people who you don't know if they're vaccinated or not, and if you can't socially distance, wear that mask. The only thing that you should be bringing to this Thanksgiving table this year is the fixins, not COVID. So if you've got some symptoms, you're not sure because you've been around folks that you don't live with, go get tested and make sure that you are not sick and protect those that you love. Booster shots are available. Last week, the CDC committee, Advisory Committee on Immunization Practices, ACIP, gathered, and they decided to recommend booster shots for all who are over the age of 18. This was a decision that was made because we're seeing nationally that in late October, our community transmission rate nationally was at 60,000 cases per 100,000. And as of the middle of November, there was a climb in those cases, an increase in the number of cases to well over 80,000 cases per 100,000. And so that is a stark increase that prompted our leaders in the CDC to examine the need for boosters, particularly for those who got their vaccination shots early on. Those are the people that we identified as being most vulnerable, and those are the people we need to protect today. If you get your booster shot as soon as possible, It will take effect after 14 days of receipt of that shot, and you'll be in good shape for Christmas. The best form of giving is to get your booster, and for those who've not been vaccinated, and DISH has recently published that their look at how many people in Texas do not have antibody coverage, they found that 25% of Texans don't have antibody coverage. So vaccinated and unvaccinated individuals need to go out there and get their vaccine to protect themselves as well. I will end this by saying that I'm thankful to be a part of this Austin community, and I'm thankful to be part of APH. Austin has done an excellent job at leading the way as far as working together as a community to protect itself from the spread of COVID-19. We've just come out of a Delta surge. The Delta variant is much more transmissible. It makes those who are ill with the virus carry 2 times as much virus. And in the period of time before you develop symptoms, you're spreading illness. So it's important that we pay attention to our surroundings. If we're in an indoor space in a public area with people that we do not know or don't know what their vaccination status is, or if they're possibly ill, it's a good idea to wear a mask indoors. The CDC recommends in areas with high or substantial community transmission that we wear masks to protect ourselves and give ourselves an extra layer of protection. We know it works. We've done it before. We've had several other surges in our recent past. In this last surge, we lost 30% of all those that have died during this pandemic. Delta is 99%, 100% of what we're seeing right now is the variant of this COVID-19 virus. I'd like to say that we in Austin are going to avoid having another surge. Let's prove them wrong. Let's have Thanksgiving together with our family safely. And I wish you all a happy Thanksgiving.
Thank you, Dr. Walks. That was a lot of good information. And I'm going to start out on the theme of thanks. Definitely the holidays are that time of year where we think of all the things that we're thankful for. We make plans for ourselves and our families to go into the new year. And so with that theme of thanks, I just want to mention that yesterday was National Public Health Appreciation Day. And so I just want to take this moment to appreciate the fantabulous Austin Public Health employees that work hard day in and day out to prevent, protect, and promote the health of Austin and Travis County residents. So whether you've engaged with us at a vaccine clinic, you went to one of our other clinics where we offer preventative health services, you were at WIC, you were at our neighborhood service centers getting help at the food pantry, you're a vendor who participates with us in a contractual agreement to provide services to community, you're the IT guys that help keep us going, or you're the budget folks that crunch the numbers to make sure that we're fiscally responsible. I appreciate you and I thank you for the work that you do each and every day for this community. And when we talk about reflection, right, this time last year, the message was stay at home because we didn't have vaccine. We were also on the verge of a surge. Since that time, with partners, we have managed to administer almost 500,000 doses of vaccine and provided over 69,000 tests. Because of that effort, 77% of residents in Austin and Travis County 5 and over have received at least 1 dose of the vaccine. Our 65 and up population has really taken the challenge on, and 95% of our residents in that age group have received at least 1 dose. And so we heard the information that Dr. Walks gave us today. We know about community transmission rate and how that can kind of predict the surge. We see what's going on nationally and close to home in El Paso and in Amarillo. And so what we want you to do is to continue to push ahead and practice those preventative measures that she talked about. If you're having symptoms, get tested. Um, it's probably too late to be fully protected for Thanksgiving, but if it's on your list of things to do while you're running out to get that last minute chicken broth or that rosemary or that sage, go ahead and get a dose of vaccine. Um, think about your holiday gathering as much as possible. Be outside, have your windows open, or the simplest thing that we can do is wear a mask. And with that, I will pass it on to Janet Pichette.
Good morning, everyone. I'm going to continue on this theme of thanks and reflection over the last year. And this time last year, Austin Public Health staff were very hard at work, beginning the surge that would soon kind of overwhelm us during the holiday seasons. Staff worked tirelessly throughout Thanksgiving and Christmas holidays to make sure that the community was safe and that we were trying to keep things at bay, but we managed to have, unfortunately, a fairly large surge. And so as I reflect back on last year, just to give you an idea, we managed to make it through 2 major surges in the Austin Travis County community. We had our holiday surge that began this time last year. We were seeing the repercussions from Halloween activities last year and beginning to see a stark increase in cases about this time last year. And we also made it through the Delta surge, which was huge and very impactful. Just to give you some perspective about these 2 major pandemic waves from last year is that at this time last year on November 25th, we reported 37,000 cases, roughly around 37,000 cases of confirmed cases. Today, we're reporting out 122,000 cases. That's almost 85,000 additional confirmed cases that we've seen since this time last year. That's huge. And much of that was related to those 2 surges. There were, at this time we reported last year, 483 deaths. Right now, we are going to report out today 1,184 deaths. That's an additional 701 deaths in a 1-year period, and it was pretty major. So we are doing all that we can and encouraging you to be responsible and make sure you have a safe holiday season. And so with that, we want to make sure that if you do plan to celebrate, that people are vaccinated. And if they're not, to make sure that they are wearing their masks and protecting loved ones. If you're out shopping, just to be safe, you need to make sure that you're also masking up, because you may not encounter, we have a lot of visitors coming in, we may encounter someone who may be positive. And if you have someone at home that you're trying to protect, go ahead and mask up. Make sure you're testing yourself if you're not vaccinated, and if you are vaccinated, just be safe out there. Our goal is to flatten the curve. Thus far, we've kept Halloween. We came off the Halloween holidays, and we've pretty much kept the cases at bay, but we want to maintain a flattened curve as we enter into the holiday season, as we enter into cold and flu season. And so it's going to be all the more crucial to make sure that you have vaccine on board in the coming months as you get ready for the Christmas and other holidays, and to make sure that you are doing those prevention measures that we always ask you to do to keep you and your family safe. That's the goal. We want to make it through the holiday. And the reason why I keep talking about some of these numbers is, we have, just to kind of give you an idea, we've seen a 33% increase in the number of newly confirmed cases last week from the previous week before that. So we are beginning to see slight upticks in our indicators. And One reason why we have not changed a stage is the possibility that we're looking at multiple indicators here. We're looking at, in the summer, we focused very heavily on hospitalization and the stress that hospitalization was having on our healthcare system. But it's more than just one indicator that we follow over the course of the pandemic, and to make sure we're monitoring the community's health. We're checking the pulse, and we're checking all the other types of indicators that may kind of highlight the potential surge that might occur in our community. And so with that, one of them is the new community transmission rate, which is actually looking at number of new cases over a 7-day period, and our test positivity rate. So with that, I'll leave that. I just want y'all to have a safe and happy holiday and Thanksgiving. There's a lot to be thankful for, and I will turn it over to Cassie.
Thank you, Janet. And we are excited to be coming to you at this phase in response as we're looking ahead to the holiday season, knowing that as a community, we have done a lot to prepare to be safe and to work toward making sure that we can gather together safely. But it's an important moment to really stop and think about what do we need to do to make sure that we celebrate and we are able to look ahead into our December holidays, knowing that we won't have to worry about our loved ones potentially getting sick. And so that's what we really want to talk about today. And we know that within Travis County, we began administering our vaccines, administering boosters. Now that we know that anyone 18 and older is recommended for a booster, we really want to make sure that everyone knows that they are available, they're free. You don't have to have insurance, and you don't need to worry about your resident status. Everyone should have access to vaccines. We really want to encourage anyone who's looking to get vaccinated to make those plans to get those vaccines. If you haven't gotten it yet, go get your vaccine. If you need your second dose, get your second dose. And anyone 18 and older can get a booster dose if it's time. So get your vaccine card out and check and see. If you were vaccinated, fully vaccinated in May, it's time. So get your vaccine card out and check it out. And you can go to a lot of different locations are offering the booster dose. Today's a good day to get it, because if you have any symptoms tomorrow, you're good and ready for Thursday. You'll be ready for the weekend to do what you need to do. The other thing, I just want to note that we're also seeing and working collaboratively quite a bit with our school system to make sure that our youngest population that's been identified as newly eligible, our 5 to 11-year-olds, are getting access to vaccine. And we're really encouraged because we're seeing families really considering that choice and making that decision. We're one of the most progressive areas that have seen an increase in that 5 to 11 population, seeing almost 20%, or right at 19% of that population has received their first dose. So that's really encouraging, and noting that it's important when it's time for the second dose, those children will be fully vaccinated in time for the next holidays that we have upcoming. And so they are getting some layer of protection. In addition to that, even our other population, our 12 to 15-year-olds that were expanded at the beginning of summer, they also have we've made some great strides. And we see that population is 65% fully vaccinated. So that's really incredible to see that we've got all of those children that previously had no layer of protection now are getting some layer. And it gives us more peace of mind as we know that we'll be gathering with our older generations, with our grandparents, with our parents, with our extended families during this weekend, to note that all of those that are coming together have potentially had that vaccine. What we also want to think about is there's still a large portion of our population here in Travis County that are not vaccinated. Either they just haven't made that decision yet, or they're part of the population that isn't eligible. We know that everyone under 5 can't get a vaccine. And we still know that those that are 5 to 11 don't have that full protection yet because the vaccine hasn't been available long enough for them to get the second dose. So we want to make sure and think about those populations as we move into this holiday season, because we need to make sure we're protecting each other. So still work towards getting vaccinated, still work towards utilizing your mask, all of the things that we've been talking about today, and we're coming to you and giving you those tools to stay protected. We want to keep those in mind as we gather to celebrate. And to close out, I'm just thankful that for this community, we've had a long time working with this pandemic, and we've done what we need to do. We know what we can do. We know we can use masks. We know how to social distance. We know how to do this safely. And we've done a good job getting vaccinated. We're one of the highest vaccinated counties in the state. We have higher vaccination rates than other major metros in the state for all age categories. That is that's impressive for us. And that just gives us that assurance that we're doing a lot to stay protected. But it's important to note, we're not out of the woods yet, and we know what to do. So again, I'm just so thankful for us as a community that we are working together and being considerate of each other, particularly at this time, to make sure that we're safe as a overall community. And with that, I'll open us up for questions.
Thank you. At this time, we will open it up to our pool reporter, Bridget Spencer from Fox 7, to ask questions on behalf of the media. Bridget?
Good morning, everyone. Thanks for having us. First question will come from us. Earlier in the pandemic, you guys talked about as far as moving stages, the threshold was hospitalizations and admissions, et cetera. So was community transmission rate being considered for the thresholds earlier in the pandemic? And if not, why is it being used now?
We've been considering a number of factors as the decision was being made to change stages. And most recently, because we have been able to use the assistance of the UT modeling group, we looked at our model projections based on the presence of the Delta variant of COVID-19 in our community, and saw that there was a possibility for a surge to occur if we moved quickly from stage 3 to stage 2 with just looking at the 7-day moving average of hospitalizations. And it showed that indeed that was the case. And in order to avoid that keep that from happening, we needed something that would help guide the community's actions and behaviors. And so with adding the community-based transmission rate, the number of cases per 100,000 in a 7-day period, we were able to inform the community about what their risk of catching COVID-19 when they're out in public spaces, particularly indoors, would be. Because this is a community effort, and the community has the ability to change the course of the pandemic. So by adding this, it was shown by modeling that we could avoid having another surge. So that's why we've added that to our risk-based chart. However, it is one of many things that we look at as we make our decision to make a change in staging.
And I'll go ahead and add to that by saying, as epidemiologists, what we do in our jobs is we monitor the trend and pattern of the disease in a community. And so we're looking at a number of indicators that kind of tell us they're warning indicators that tell us, how we're doing as a community at large. And while we had many indicators that were beginning to decline, community transmission rate gives you an idea of what the potential is as far as disease transmission risks out in the community. And so, as I mentioned earlier, During the summer, we saw a lot of stress on our healthcare system. And so we were very focused on hospitalization rates, the impact of staffing shortages, ventilator capacity, and ICU beds. Those things are very important as far as the health and stress on the healthcare system. However, we are always monitoring what the number of new cases are, the test positivity rate that's occurring, because those tend to give us indication of what the potential is for disease spread in the community. And if we have all of those factors in check, it will help us drive our stage down. So we need to make sure that we're being mindful of all of those indicators as we move forward.
Okay, thank you very much. Next question from KXAN. The UT Modeling Consortium released several projections last week that show there could be another holiday spike depending on behavior. What should the public take away from those projections?
So, as I was just mentioning, we're trying to inform the public about what the risk is when they're in indoor public spaces during this holiday time, particularly when they're out getting ready for gatherings, or if they're leaving their home and going to places where they're going to encounter people that they don't normally see, live with, they don't know what their vaccination status is. With looking at that risk of interaction or encountering COVID-19 in those public spaces, they will be able to look to the other things that we know have helped keep us from having COVID-19 spread in our community, such as social distancing, masking. And then if they encounter or have exposure to COVID-19, they can monitor for symptoms when they come home if they're vaccinated, and test if they develop symptoms, and wear masks so that they can protect those that they may be around who are unvaccinated and unprotected. And if they're unvaccinated, they can test and then remain in quarantine after that exposure. So the guidance that we're adding to our risk-based guidance chart, that is the community transmission rate, is to help inform the community about how they can protect themselves and their loved ones.
Thank you. Next question is from CBS Austin. Do you think Austin will remain in stage 3 through the holiday season as a preventive measure, since we're within threshold to move to stage 2?
We're not out of the woods, and I'm going to punt this over to our epidemiologist because she's seen COVID in action last Thanksgiving timeframe and knows what surges look like.
So I'll just say this time last year, as I mentioned in the introduction, we were in the middle of increase and the beginning of a surge, or we were pretty well into the surge that was going to take us through the holidays, through January timeframe. It's that time of year where it's cold and flu season, there's holiday gatherings, or people getting together. It's colder outside, so more people are inside. And there's just the potential for not just developing COVID, but being exposed to flu and other types of respiratory viruses. So, like I said, our indicators have really gone down. Some of the key indicators that we look at, like hospitalizations, like number of cases. However, with last week, we saw a 33% increase in the number of cases from the week before. That causes me to pause a little and say, okay, what's going on? Do we have people who their vaccine is waning a little bit and they need to get boosted? Do we have people who are not masking and getting a little lax in their mask wearing when they're out and about? Just keep in mind, these are just like there are a bunch of indicators that we're watching, there are a bunch of factors that could influence your development of disease. because we just are asking the community for continued vigilance at this time, especially as we enter cold and flu season, and the potential to gather with individuals. We want to have a safe and happy holiday as we go into the holiday season in December as well. We need to do all those things that we've been saying for 2 years now to protect yourself, and you know, we need to do the right thing and hopefully flatten the curve and keep it flat.
Next question is from KUT. Do you recommend that people traveling out of town for the holiday quarantine for a brief period before returning to normal activities next week? And does that guidance differ for the vaccinated or unvaccinated?
If people have an exposure and they are vaccinated, it's recommended that they wear a mask and monitor themselves for symptoms. And if they develop symptoms, they should test themselves and protect those around them who are unvaccinated or are at risk for severe disease, such as the elderly or immune compromised. Those people who are unvaccinated and are exposed to COVID-19 during the holiday season should follow the quarantine guidance that's outlined for those who are unvaccinated. And they should test to make sure that they do not have COVID-19.
Next question is from Univision. What are the recommendations for people who are not vaccinated?
Those who are not vaccinated are at 13 times the risk of developing illness and 20 times the risk of requiring hospitalization and or dying from COVID-19 as a result of this Delta variant. And that's some data that came from a recent Department of State Health Services study. So the real answer is for them to get vaccinated. And in the event that that does not happen, they should wear a mask to protect themselves from developing COVID-19, socially distance. And if they're sick, they should get tested so that they can determine whether or not they have COVID-19 and seek medical attention to see if they're eligible for monoclonal antibody therapy. The real strategy that helps protect people from developing COVID-19 for those that are unvaccinated is to practice social distancing, masking, but ultimately we have the tool to protect them, and that is get vaccinated. And vaccines available, it's free. You don't have to prove residency, you don't have to have insurance. It's that easy, and I urge anybody who's unvaccinated to really consider being vaccinated. There have been 452 million plus vaccines given in this country, 36 million booster doses given. We have shown that this is a safe product, and it's important that we all take advantage of protecting ourselves and our family by getting vaccinated.
Next question is from The Statesman. Do we have any timetable of when we might reach stage 2? The dashboard yesterday showed the transmission rate was substantial, but the daily hospitalization average was down to 12.
Do you want to take that, Janet?
I can. So again, as we said earlier, we're looking at a number of indicators before we'll drop down to the stage 2 level. And one of the big indicators that is keeping us from reaching stage 2 is our community transmission rate. CDC has marked us as having moderate exposure in the Austin, Travis County area, meaning that there's still the potential risk for individuals who are out and about to expose themselves to COVID-19 and transmit that disease to other people nearby them, people they live with, people they work with, people they play with. So, it's those things. Again, we're looking at this collectively. We like how the hospitalization numbers are down. We would like to see, I'd like to see more flattening of the curve. We're beginning to see upticks in our number of new cases, and we're watching that very closely. And test positivity rate, our test positivity rate is getting closer to 5%. And when it becomes greater than 5, we need to, we need to make sure that that's a better indication that we have more transmission in the community. So we're at 4.8%. We need to get that lower than that. And I think once we get to all those indicators being at the right level, then the risk-based stage will decrease.
I'd just like to add that we have learned from our previous surge that the community transmission rate goes up before we actually see hospitalization rates go up. There's a lag because of due to the fact that people get sick, and then after a certain amount of time, they become sick enough to require hospitalizations. So watching the transmission rate has informed us and has informed the CDC most recently in the ACIP committee hearings that there is an increase in community transmission not only here, but in other parts of the country. Here, we've had less community transmission rate rises than there have been in other parts of the country, but we don't really want to copy follow suit with those other places. Our community transmission right now is 60 cases per 100,000, which is considered substantial transmission. And the recommendation is to mask. Everybody should mask indoors in public places to protect themselves, to give themselves a layer of protection for those who are unvaccinated, and for those who are vaccinated to give themselves an extra layer of protection from developing COVID-19. We have seen that in places where that community transmission rate is going up, that there's been an associated need for more booster shots in the community. So we're asking our community to get booster shots if they're eligible for such at this time. We've also seen that there's been a decrease in a number of people masking. And so we're asking our community to mask one more time. It's a small thing to do, to put a mask on when you're in a public place, to protect yourself, to protect your children, your grandchildren, your mom, your dad, your aunties. Just those two things can be the gift that keeps on giving and can keep us from having those hospital numbers going up, and can keep those who may have those vulnerable individuals at their home in a place where they are sitting at the table sharing Thanksgiving dinner or whatever celebration it is that we're looking forward to in the next few months, as opposed to wondering how they're doing in the hospital. So it's really important right now to just do this one thing: wear a mask in indoor public places and protect yourself from getting COVID-19.
Next question is from KView. The CDC says the booster shot is available for people over 18 and is recommended for other high-risk groups. Who actually needs to get the booster shot?
So with the new CDC recommendations, anyone who has been fully vaccinated and is 18 and older and it's 6 months past the time that they've received Pfizer or Moderna, should consider getting the booster shot. Regardless, we know that the immunity wanes after 6 months. And so we want to make sure, even if you're a healthy individual, that you get that extra layer of protection so that it reduces your likelihood of contracting the virus. And then also increases your ability to, if you should contract the virus, protects you from being able to transmit the virus to others. So it's really important, if you're 18 and older, to get the booster. If you have received the Johnson & Johnson vaccine, anyone who received the Johnson & Johnson vaccine, that's an 18 and older vaccine recommended, you need to get a second dose after 2 months. And so those are really important things that if you need to pull your vaccine card out, look at those dates and start making a plan to get a booster. If you're 18 and older and you've been fully vaccinated, it's time to consider your booster.
Great, and we're going to start on our second round of questions here. With mine being just a quick clarification question. Dr. Walks, you were saying, how a holiday dinner should look. How would a Thanksgiving dinner look right now? Vaccinated or unvaccinated? Does everyone wear a mask anyway, et cetera? How would a good, healthy gathering look on Thursday?
Well, the best would be for us to have everybody at the table vaccinated. If there's somebody that is unvaccinated or not fully vaccinated coming to dinner, I would recommend that they test before coming to the home. And if they're around someone who is vulnerable to or at risk for getting really severe disease from COVID-19, they should wear a mask around that person if they don't have that test that shows that they're negative. And the mask for the person that's vulnerable may be something that you might want to consider if you're not requiring testing for people that are coming into the home, just to protect them from getting sick. But ideally, you would want to know what the status is of the people that are coming into the home. Vaccines are protecting us from developing the Delta variant of COVID-19, and that's a good thing. But if someone has been exposed to COVID-19 and they're unsure as to whether or not they may have asymptomatic illness, they should go ahead and get tested.
Next question is CBS Austin. Oh, no, I'm sorry, KXAN. The weather this week is expected to be rainy and cold. Are you worried that will push people inside that may have otherwise done outdoor gatherings? And what tips and tricks do you have for the people in that situation?
I think it's just a repeat of what Dr. Walks just said. If you're not sure of the vaccination status of the persons that you invited to your home, you ask them to wear a mask, or maybe you change your plans and you have a smaller dinner. Each family has to decide what level of risk they want to take for their household and their extended loved ones. And while Thanksgiving is an important family time, for me, I want to make sure that I'm able to see my family in the future. And so if I have to change my plans in order to be sure of that, then that's what I'm willing to do. So it's either stick to a gathering with the people that you usually live with and you know their vaccination status, or just have everyone test and mask up when they come into your home. And Dr. Walks, I don't know if you have any additional information or guidance you would like to add to that.
No, Director Syrup, I agree with you. We all have to decide our level of risk tolerance. And at this point, we need to, I believe, protect those that we love. And that means looking at what it is that we're willing to expose them to and protecting them from getting the illness or COVID-19 if we have the ability to do so. And we all have the ability to do so. It's a choice.
Great, thank you. Next question is from Untitled Chapter. The weather this week is expected to be rainy and cold. Are you worried that will push people inside that may have otherwise done outdoor gatherings? And what tips and tricks do you have for the people in that situation?
If we have the ability to do so, and we all have the ability to do so, it's a choice.
Next question is CBS Austin. Austin has seen a strong response to COVID vaccines in the past. Do you see a similar response to the booster shots so far?
We definitely have seen an increase in booster vaccines since the expansion to all ages or to 18 and older, recommended for everyone. We do want to encourage folks. It's not yet to the coverage we'd like to see, knowing that majority of our population that's fully vaccinated, that's within that 18 and older age range, are eligible for a booster. So we really want to see those numbers tick up quite a bit in the coming days and weeks, so that we have know that majority of that population is fully vaccinated. Right now, we're right at about 135,000 have received that additional dose. And that includes third doses, those who were severely immunocompromised that were authorized early on. And then others that were approved for boosters at the end of September, and then when Moderna and Pfizer and Johnson & Johnson were approved for boosters. So we do want to really make sure that folks are aware of their eligibility, are looking at their vaccine cards, and they're making plans to get that booster so that they have that layer of protection. And are aware of where they can get that. They can go to vaccines.gov. We have walk-up clinics both today and tomorrow available for anyone who's needing a booster or their first or second dose, or a pediatric vaccine. So we want to encourage everyone who's needing vaccine to find a location to get that additional dose or get their initial vaccine, and think about kind of how we can continue to be healthy and safe from COVID. Vaccine is, and we've heard this a lot, is the way for us to tamp down this pandemic and help to stave off the spread. And so if we can get more of our population protected, and with those who are starting to have waning immunity set in, we can get them that extra boost, we can do something about protecting our community and hopefully not see a holiday surge similar to what we saw last year.
Next question is from Univision. How many days in advance do people need to get tested before traveling and gathering?
The recommendation would be at the most 72 hours before they go off to their location, so that they would have an opportunity to receive those results prior to their departure. If they are able to get a test back even more promptly, 48 hours would be ideal. But in any case, any time between 72 and 48 hours of that arrival at their new destination would be ideal for assessing whether or not they have a negative test and are free from COVID-19.
And I'll add here that there are a number of rapid antigen tests that are available over the counter that you can go and pick up at your local pharmacy and administer the day of your family gathering before you head over to visit someone. That can give you some assurance that you're negative from COVID. I do want to mention this. Because we've seen this a lot as far as people who are what I call test shopping. There are people who are getting a PCR test or they're getting a rapid antigen test, and one test is positive, and the subsequent they don't really believe the results, so they go on to get another test or another 2 tests, and those may be negative. If you have a positive test that pops up, you need to consider yourself positive, regardless of what your subsequent test may be, especially if you're within 10 days of that test collection. So be mindful that, there are times when you may not have self-administered a test and gotten deep enough into your nasal cavity or nasopharyngeal swab to get a good sample, because we know it's an uncomfortable test to take. But there are all kinds of things that could be the reason for that false positive or false negative. odds are if you have a positive, you're positive. So just keep that in mind.
Okay, and this will be our last question coming from KView. We're told to wait 6 months after the COVID vaccine dose, after the second COVID vaccine dose to get the booster. But what if you were infected with COVID? How long should you wait after infection?
The recommendation from the CDC is for COVID test to be, COVID vaccination is something that you can receive as soon as you've recovered. We are operating on the assumption that the protection that is given from having the infection lasts for up to 90 days, but you can receive the vaccination as soon as you've been assessed as being recovered from COVID-19. And ideally, you should get that vaccine dose as soon as you're able to do so to get yourself that full protection from COVID-19.
And I'll add just on to what Dr. Walks is saying. So the recovery period for COVID is 10 days. So if you have a positive test, 10 days beyond that point, if you're asymptomatic, if you are a symptomatic person and you become positive, you get a positive test, it goes from 10 days from your symptom onset to the end of your recovery period. So anytime after that 10-day period, you should be eligible to get a vaccination.
Thank you. That concludes all of our questions for today. A special thanks to Dr. Walks, APH Interim Director, APH Interim Director Adrian Stirrup, our Chief Epidemiologist Janet Pichette, and our Chief Administrative Officer for Disease Prevention and Health Promotion, Cassandra De Leon, and to our pool reporter, Bridget Spencer from Fox 7. Thank you for joining us today. Have a safe day, and however you celebrate, please ensure that you are safe doing that as well. Thank you. Have a good day.